Morning and thank you for the opportunity to present today. My name is Chu Wu, and this presentation summarizes the knowledge that I have gained throughout this course while examining human resources practices at my current hospital, Santa Clara Biomedical Center. Throughout this course, I developed a great understanding of how human resources serve as a strategic business partner that support both employee and organizational success. My perspective is based on my experience working within the organizations during the past 6 years. I have served as a staff nurse, a unit scheduler, also as an interim assistant nurse manager. And recently, I have accepted a permanent position as an assistant nurse manager position. These experiences have allowed me to observe how strategic human resource decisions affect frontline employees, daily operations, and patient outcomes. They have also reinforced the importance of developing employees, supporting effective leadership, and maintaining a positive workplace culture. The purpose of this presentation is to summarize key concepts learned throughout this course while evaluating how SCVMC acquires, develops, trains, and leverages human capital. I will discuss current strength, identify opportunities for improvement, and then present recommendations supported by the current research, literatures, and explain how I will apply these concepts as I continue developing as a healthcare leader. Santa Clara Biomedical Center is a county-operated healthcare system that serves one of the most diverse communities in California. As a public safety net organization, the healthcare system provides care regardless of patients' financial circumstances and insurance status. This mission creates a unique workforce challenges because the organization must deliver high quality patient care while managing limited financial resources that include staffing shortages and changing in healthcare demands. Resources play a very important role in supporting the organization missions because they are responsible for recruiting qualified employees, facilitating onboarding, as well as maintaining compliance with employment laws. Dessler 2024 explains that strategic human resource management aligns workforce practices with organizational objectives, allowing organizations to improve both employee performance and long-term success. From my experience working at Santa Clara Biomedical Center, I have observed how HR decisions directly affect frontline operations. Timely hiring helps reduce staffing shortages, especially during COVID times, while leadership's development and continuing education prepare employments for greater responsibilities. Fair employment practices also strengthening employees' trust and workplace culture. Um, Scott's 2022 finds that organizations with engaged employees often experience better organizational performance and improvement patient outcomes. These observations reinforce the importance of viewing human resources as a strategic partner rather than solely an administrative function. Recruiting and selecting qualified employees is one of the most important responsibility of HR because the quality of an organization's workforce begin with hiring process. SCBMC follow a structured recruitment process that promotes fairness, transparency, and compliance with federal, state, and county employment regulations. Applicants complete standardized applications, participate in behavioral interviews, undergoing reference and background check before employment offers are extended. These steps help ensure hiring decisions are based on qualifications, organizational needs, and equal employment practices. One of the strengths from the organization is its commitment to internal career advancements. Employees are encouraged to pursue promotional opportunities, allowing the organizations to retain experienced staff while developing future nurses. My own professional growth reflects this approach as well. I began my career as a frontline clinical nurse during COVID time, and later I had an opportunity to serve as an interim assistant nurse manager. And then recently I accepted a permanent position in this field. internal advancement help preserve organizations knowledge while creating meaningful career opportunities for employees. SCVMC also offers competitive compensations and benefit that helps attract healthcare professionals seeking long-term careers in public serving, recruiting experienced nurses and other healthcare professional remains challenging because competition for qualified clinicians continue across the healthcare industries. Santa Clara Biomedical Centers has established a structured hiring process that supports fairness and compliance with public employment regulations. Even with these strengths, there are opportunities to improve recruiting and retentions. Similar to many of the other healthcare organizations, this healthcare system continues to experiencing staffing challenges related to nursing shortages and competitions for experienced healthcare professionals. Lengthy, lengthy timelines can delay filling vacant positions, um, as well as increasing workload for existing staff and contributing to additional overtime. Um, Maintaining compliance remains essential, but improving recruitment efficiency could help reduce vacancies period while preserving hiring standards. Retention is equally important as well because replacing experienced employees requires substantial times. Um, HR needs to find the correct time to find, developing, and recruiting the right experienced nurse for the county. Experienced nurse who provide guidance, support, help new staff building confidence, develop clinical skills, becomes integrated into the unit culture. During my time here at VMC, I have seen how supportive preceptors and informal mentors positively influence employment, engagement, and transitions into practice. Workforce planning is also playing an important role in maintaining staffing stability, monitoring turnover trends, and identifying future staffing needs, and preparing employees for leadership opportunities allow organizations to make proactive workforce decisions. Investing in this area can strengthen workforce stability while supporting the organization's commitment to providing safe, high quality patient care. Developing employee is an ongoing responsibility that extends beyond the initial orientations period. At VMC, new employees participate in orientations to become familiar with organizational policies, clinical expectations, and patient safety standards. After the orientations, employees complete the annual competencies with the unit's managers um, to ensure that they are up to date with their mandatory educations to maintain clinical knowledge and meet regulatory requirements. These trainings activities help ensure staff members remain prepared to provide safe, evidence-based patient care. Um, Performance evaluations are another important concept of employment development. Rather than serving only as an annual assessment, performance evaluation provide an opportunity for leaders and employees to discuss accomplishments, identifying areas of improvement, and establish meaningful professional goals. We understand that every employee brings a unique sets of knowledge, skills, abilities, and experience that contribute to the organizational success. Effective leveraging these strengths allowing healthcare organizations to improve employee engagement, strengthening teamwork, and enhance patient care. At VMC, employees have the opportunity to share their expertise through interdisciplinary collaborations, committee involvement, and shared governance. These activities encourage employees to participate in decision making while contributing ideas that improve clinical practice and operational success. Cross training is another strategy that strengthening organizational flexibility by expanding employee competencies and preparing staff to adapt to changing patients' care needs. Recognizing employee strength during performance evaluations also encourages leaders to build upon existing capability instead of focusing primarily on deficiencies. So because of that, leveraging employee strengthens and embracing workforce diversity creates a more engaged workforce, support collaborations, and help organizations achieve better performance outcomes while maintaining high quality patient care. VMC already has an established HR department that supports recruitment, employee regulations, compensations, benefits, and compliance. As the organizations continue to respond to workforce challenges, strengthening collaborations between HR and operational leaders can further improve employee support. HR personnel play a very important role by assisting managers with employee relations, performance management, and policy interpretations. HR specialist provides expertise in areas such as recruitments, benefit administrations, labor retentions, and talent acquisitions. Its leaders focus on workforce planning, succession planning, and organizational strategies, while HR consultants can provide guidance during major organizational changes and process improvement initiatives. Each role contributes unique expertise that supports employees in organizational goals. A Christian Worldwide view support effective HR practices by emphasizing respect, integrity, compassion, and inherent dignity of every individual. These principles encourage leaders to treat employees fairly, value diverse perspectives, and foster an inclusive workplace where employees feel respected and supported. Applying these values helps strengthening the trust, teamwork, and positive organizational culture while remaining respectful of employees from all backgrounds and beliefs. Based on the concepts that I have learned throughout this course, I would recommend several strategies that support workforce development while aligning with organizational goals. First, continuing to improve workforce planning can help leaderships anticipate staffing needs, reduce vacancy periods, and prepare employees for future leadership positions. Proactive planning allows organizations to respond more effectively to workforce changes while maintaining continuities of patient care. Leadership development should remain another priority. Providing mentoring opportunities, leadership educations, and individualized development plans help prepare employees for future management roles while supporting succession planning. Developing internal talents preserves organizational knowledge and encourages employee retentions. My own experience transitioning from an interim assistant nurse managers to a permanent leadership position reflect on the values of investing in employee development. Technology is also playing an important role into strategic human resource management. HR information systems and workforce analytics can assist leaders in monitoring turnover trends, staffing patterns, employee engagements, and educational needs. Using the data to guide workforce decisions allow leaders to allocate resources more effectively and respond to organizational challenges in a timely manner. Last but not least, organizations should continue promoting knowledge sharing while maintaining compliance with federal, state, employment laws. Consistent applications of employment policies, equitable hiring practices, and ongoing leadership educations help protect both employees and the organizations. These recommendations support a stable workforce while contributing to high-quality patient care and long-term organizational success. This course strengthened my understandings of how HR management contributes to organizational success. Although my career in the nursing leadership Rather than in HR, I recognize the effective leaders apply many HR principles while supporting employees and making workforce decisions. As I begin my role as an A&M, I plan to use the knowledge gained from this course to strengthen engagement, improve communication, and promote a positive work environment. One area I plan to focus on is coaching and mentoring employees. Providing timely feedback, recognizing employee strengths, and supporting professional developments can improve confidence and encourage uh, continuous learning. I also want to strengthen collaboration with HR department when addressing recruitment, employee relations, and performance management. Working together allow leaders to make informed decisions that remain consistent with organizational policies and employment regulations. My personal development plan also include continuing my leadership education, completing my Master's of Science in Nursing Leaderships, and seeking opportunities to expand my knowledge of the workforce planning. These goals will help me become a more effective leader while supporting both employees and organizational objectives. In conclusions, this course has strengthened my understandings of the important role of human resources plans in achieving organizational success. Human resources management extends beyond recruiting and hiring employees. It includes workforce planning, employee development, performance management, legal compliance, and creating a workforce culture that supports employees' engagement and organizational effectiveness. Each of these responsibilities contributes to the organization's ability to provide safe, high-quality patient care. Now reflecting on my time here at VMC, I recognize many strengths that support employee success, including opportunities for professional development, internal career advancements, and commitment to serving a diverse community. I also identify opportunities to strengthen recruitment efficiencies, mentorships, workforce planning, and knowledge sharing. Addressing these areas can improve employee retention while preparing future leaders to meet the organization's evolving healthcare needs. These courses also reinforce the importance of leadership. Effective leaders recognize employee strength, encourage professional growth, making ethical decisions, and collaborative with HR to support both employees and organizational goals. As I continue my leadership journey as an assistant nurse manager, I plan to apply this principle to support employees, strengthening teamwork, and contribute to a positive workplace culture that ultimately benefits both patients and staff. Thank you for listening, and